We're continuing with the internal genitalia. We only haven't covered the last final structure of the internal genitalia, and that's the vagina, which is a thin-walled tube. It's 3 to 4 inches in length. It's a birth canal. It's a passageway for menstrual flow from the uterus. And recall, even though we said it's a birth canal, the fetus develops in the uterus, but will have to travel through the vaginal canal during the birth process. And it's an organ of copulation or intercourse. And this next point is often missed, even with females sometimes, so it's important to note this here. Extends between the bladder and rectum from the cervix to the exterior. So here's the cervix, here's the exterior, but it is between the rectum, and there's anus there, and the urinary bladder and urethra. So in the male reproductive system, this urethra was the exit point. But in the female reproductive system, the urethra is totally separate from the reproductive system. So there's actually 3 openings here. The urethra from the urinary system, right? The rectum anus from the digestive system, and vagina from the reproductive system. Right? So that's an important point of the separation between these systems. Vaginal secretions are acidic in adult females. Infections typically do not like acidic environments, so that helps to fight infections. But alkaline in adolescence, so in young females, it is not an acidic environment, which is why teenagers who are sexually active are predisposed to STIs because of that alkaline environment versus an acidic one in an adult. And on these next 2 slides, we're going to go through the external genitalia, collectively is called vulva of the female. So let's just go through each one of these. External genitalia is called vulva. It includes the mons pubis, which is here, which is the fatty area overlying the pubic symphysis, if you can picture that pubic symphysis there from the skeletal system. There's the labia majora, which is this fatty skin fold, but the external one, which is homologous, it says here, with the male scrotum. There's the labia minora, that's the hairless inner skin fold. The vestibule, which is shown with a bracket here, is this entire recess within the labia majora, labia minora. The hymen is an incomplete partition at the distal vaginal orifice, and here they show it's ruptured, which could become ruptured for a number of different reasons, and if it does, it may bleed when stretched or ruptured. That would happen during first sexual intercourse, or sometimes it doesn't have to be that. Sporting activities can cause that, tampons, pelvic exams, so many reasons that the hymen may be stretched or ruptured. Now, with a lot of tissue removed, we can look a little deeper at the external genitalia or vulva, and we can see these glands on either side of the vestibule called the greater vestibular gland, and there's 2 of them there, and they're going to release mucus into the vestibule for lubrication. And you might think back to the male reproductive system. We covered the bulbourethral gland, and it had the exact same job, lubrication. The clitoris right here is homologous to the penis of the male reproductive system, where the body right there has erectile tissue, and also the bulb of the vestibule, or bulbs, plural, of the vestibule, engorge with blood during stimulation, and that is important to close the urethral orifice. That's needed because that prevents semen and bacteria from entering the urinary system during intercourse. So you can see why that females tend to get urinary tract infections at a higher frequency because of how close the urinary system is here to all of these other areas. So it's important to close that urethra off during intercourse to prevent the bacteria from entering the urinary system. Mammary glands are present in both male and female, but normally function only in lactating females. They're modified sweat glands, similar in structure to sweat glands, but of course they don't produce sweat. They're going to produce milk, which is their main function, to nourish a newborn. So let's look at the anatomy of the mammary glands. The areola is the pigmented skin around the nipple. They contain large sebaceous glands, which gives it a bumpy appearance. Sebaceous glands, as we know, secrete oil to prevent chapping of the area. There are suspensory ligaments. You see those here looks like in white. And the suspensory ligaments attach the breast tissue to the underlying muscle. You can see the pectoralis major right here. And suspensory ligaments are important to connect the breast tissue to the muscle tissue. Each mammary gland contains 15 to 20 lobes. So we're looking here, we see these sections. There's one lobe, there's another, there's about 4 or 5 lobes that you can see here. However, there are in total 15 to 25 lobes throughout the mammary gland. So we can get a little more specific. If we look inside a lobe, there's all these little circular sections that are called lobules within each of the lobes. And the lobules contain granular alveoli. I'm looking where it says that. Here it is, granular alveoli that produce milk. So milk is produced inside these alveoli. Milk is passed, when it's time, into the lactiferous ducts, which we see here in a gold color or yellow. And from the lactiferous ducts, the milk will enter these sinuses called lactiferous sinuses that open to the outside. And in non-nursing women, the glandular structure in here is largely undeveloped. So breast cancer, second most common cancer in U.S. females. 1 in 8 will develop it in their lifetime. Usually arises from the epithelial cells, which is typical with cancer, epithelial cells, because they tend to divide more than other cells. But epithelial cells of the ducts of the mammary glands. And their specific risk factors, an early onset of menstruation and late menopause. So the more cycles someone has, the higher risk of breast cancer because of the hormones that circulate during those times. No pregnancy is a risk factor, or a first pregnancy late in life would also be a risk factor. Hormone replacement therapy after menopause, which is why they often don't recommend hormone replacement therapy, because that is a risk factor. Family history is a big one for breast cancer, especially if there's mutations in these specific genes, BRCA1 or BRCA2, that they found. And it says 70% of women have no risk factors and still get breast cancer. So of the other 30%, it's due to these risk factors, but it almost seems to be unpredictable with most females. To diagnose breast cancer, early detection, of course, is always a key with any cancer. Self-examination is one way to feel for bumps. That has not proven very reliable because many people don't know what to feel for. A mammogram, which is an x-ray of the breast tissue, which is being shown here, recommended every 2 years after 50 years old, but even earlier if someone's in a high risk group that we mentioned on the previous slide. And they're just showing here a film of a normal mammary gland versus a tumor, which you can see it light up because of the extra mass or the malignancy. And this slide shows the different treatments for breast cancer. We should know the difference between these terms here. So until the 70s, the standard treatment was a radical mastectomy. Sometimes that's still needed, but not always. But what a radical mastectomy is, first of all, ectomy means to remove, where mast has to do with breast tissue, so removal of the breast tissue. But it's more than that. Radical mastectomy removes the breast tissue, but also the underlying muscles and fascia and the associated lymph nodes. This is how the breast cancer often spreads through the lymph nodes in the underarm area, the axillary lymph nodes. So all of that was removed in what's called a radical mastectomy. Typically now, depending on the type of breast cancer, a lumpectomy can be performed, and which is much less invasive, like it says here, where it excises or removes only the cancerous lump that's found. A little more aggressive than that is a simple mastectomy, which removes only the breast tissue and sometimes the axillary lymph nodes, because that's where the metastasis takes place, or the spreading of the cancer. So that removal of that would remove the route for the cancer to spread. So that's a simple mastectomy. It does not include removing underlying muscle and fascia. Some women opt for breast reconstruction following one of these: simple mastectomies, lumpectomies, or radical mastectomy. Also may include radiation therapy or chemotherapy during times when the cancer is diagnosed. And we can see that the 5-year survival rate is greater than 90%, thanks to all of the research that takes place that involves breast cancer, one of the more well-funded areas, which is a great thing. If estrogens are stimulating, then a treatment could involve drugs that block estrogen receptors. So this is sort of, think back to the male reproductive system in prostate cancer. Recall that testosterone fuels the prostate enlargement and the cancer. Well, in the female reproductive system, it's the estrogen that fuels the cancer. So drugs can include, drug therapy includes blocking those estrogen receptors. So there's less fuel on the cancer.